to Hump Day. It is Wednesday, the 13th of May. Delightful to be here again this morning to talk with you all about the wonders and the vagaries of COVID-19 and all that is is associated. So, my name is Bron Pearson. For those who've not yet met me or know who I am. And I'm from Pinnacle People Solutions, and we are providing human resource services, advice, solutions, support, strategies to regionally based business and enterprises and not-for-profit organisations. We specialise in supporting regionally based small to medium enterprises and not-for-profit organisations. We are here to help you. Good morning to the people who are joining us this morning. I can see you there up in the comments screen. That's fantastic. We're here to help you and your business through these challenging COVID-19 times. So this is our 9th week of daily weekday COVID-19 live streams. And we've got updates every day on new information that you need to be aware of and more detailed information about topics relating to staffing and to business management. So please ask any questions that you have as we go along. I'll do my best to answer those, and I'm sure in a moment you're going to get our contact details come up in that chat screen. So outside of putting any comments or questions in the chat screen today, please feel free to contact us in all the other forms that are available to you. So private message, of course, on Facebook, but also email, telephone, website, YouTube channel, LinkedIn. We are up and available in all of those formats. So whatever one works for you, don't hesitate to get in touch with us and ask us any questions that you have. We would be delighted to help you. So let's start with some updates since Monday, because of course yesterday we had a fantastic live stream presentation from our consultant psychologist Jessica, who took us through some fantastic mindfulness strategies for dealing with the stress and anxiety that's certainly visiting some of us, a lot of us during this COVID time, whether we're business owners or whether we're staff. Or whether we're immunocompromised or whether we're just plain frightened, all of which is perfectly understandable in the circumstances. So, Jess, I'd encourage you to go up and have a look at that. These live streams are recorded and they're available on our Facebook page, our YouTube channel, and in LinkedIn after they've been held every morning. And so I would encourage you to have a look at Jessica's live stream yesterday. Fantastic mindfulness strategies. I've certainly started to do them and found them really helpful. So put that into your calendar and help yourself along during these really challenging times. So some updates since Monday. So we're still all urged to stay at home if we're sick, to obviously keep up social distancing and hygiene practices and follow any local restrictions to avoid a second wave. So one of the things we need to be really well aware of is, and I talked about this on the special Saturday live stream and again on Monday, is that we've had some announcements about gradual easing of some of the restrictions state by state, territory by territory. And if you have a look at Monday's live stream or Saturday's live stream, you'll have information about what those things look like. For New South Wales, they come into effect from this Friday, the 15th. Obviously, with the easing of restrictions, there is the chance of an increase in infections. And this is something that is of particular importance for us to be considering today, given that our topic today is on broadly around workplace health and safety and how do we get back to work and in what forms and how can we get back into the office potentially. So it's incredibly important that that you're aware of what those public health notices are. We had no New South Wales coronavirus cases as of Tuesday morning, but I believe there's about 4 from this morning. And we've had schools in Victoria and New South Wales start back again this week. I know I've got a couple of team members who are very happy about about that. Bless them, they've done wonderful and continue to do wonderful jobs to balance or try and balance all of those obligations to both family, children, work, etc. It's a minefield. It really is. So I'd take my hat off to all of you who are in the midst of that never-ending juggle at this particular point in time. So there have been some of the developments that have happened since Monday. Today and tomorrow, we're putting particular focus on work health and safety, and there's a very, very good reason. Well, there are lots of very good reasons for that. And the first of which is because the onus on employers around work health and safety is significant. And from our experience in working with regionally based small to medium-sized businesses and not-for-profit organisations, one of the things that we're acutely aware of is that a lot of employers don't understand or have not known about or informed. Good morning, Elizabeth. Lovely to see you. We're delighted to have so many different people joining us for these live streams. It's fantastic. I hope you get good information and resources out of it for you as individuals and also for your businesses. So, as I was saying, the health and safety obligations for businesses are really quite onerous. And it's incredibly important that you inform yourself as to what your duties and responsibilities are. Can I say, with all of this that we're talking about in terms of health and safety today and tomorrow, just to remind you that if you're not sure what your obligations are, if you're really anxious and nervous, as any of us should be as business owners, about how we're what our obligations are to protect our staff, just in general, but particularly during this period of COVID, you should be nervous and you should be concerned, and you should inform yourself, and we can help. So we can take your hand, figuratively speaking, and walk 2 meters beside you, and do this with and for your business to make sure that you're doing the things that you need to be doing. And it really is a movable feast at this point in time, because we've never had this in modern times. It has all sorts of implications, and you already have, as employers, really substantial health and safety obligations under the current legislation. And the risks to you and to your staff during the current pandemic are even more substantial. So, and the risks to you and your business, your livelihood, all of those things are substantial from inadvertently, not necessarily intentionally, but lawfully it makes no difference, getting things wrong. So, so talk to us. So how do we get back to the job at hand in whatever forms it's possible for us to do that, and into the office? I think one of the most important things to remember through all of this is to make sure that you're communicating regularly and often with your staff about what's happening. So you need to understand your obligations, you need to have a good plan, and again, we can help you with all of those things. But you also need to be communicating regularly and often with your staff about what's happening. Get advice on how to handle a staged return to work, particularly for any staff that are stood down or have had their hours, days, rosters, etc. shifted, whether you're JobKeeper eligible or not. So whether you've done that in accordance with the JobKeeper enabling directions, or whether you had to put this in place before that came in and you therefore made stand down notifications under the stand down provisions in the Fair Work Act. And I've got a couple of questions that have come in relating to that, which will take us there in a moment. It's incredibly important for you to be communicating with your staff, because in the current situation we have so much information. which is one of the reasons for us doing this daily live stream, is to try and cut through that and make sense of it in a practical way for businesses and their staff moving forward. So there's so much information swirling about that if you don't keep your staff informed and keep that communication nice and regular and often, then they'll fill that vacuum of information with stuff that may or may not be relevant or accurate for your particular circumstances. So incredibly important to communicate, much more than you would normally do. Also, make sure that you check out the work health and safety obligations that you have. I mentioned in a few of the live streams now, since the COVID-19 health and safety principles were introduced a few weeks ago by the National Cabinet. The National Cabinet made the decision to establish Safe Work Australia as the repository of resources, advice, information, etc. to businesses to do with health and safety, particularly during COVID. There is industry and profession specific resources available on the Safe Work website, as well as toolkits. And bless my team, they're already on it, giving you the links to those details. So what I'll be referring to this morning, just in terms of the practical realities of your health and safety obligations, actually relate to some of the documents that are available up on the Safe Work Australia website. So just be really mindful of that. So one of the questions that we've had, not surprisingly, given the COVID circumstances, has been, what do I need to do to keep my workers safe and to limit the spread of COVID-19? And this is going to be the case for all businesses, but particularly for those that are public facing. So if you deal with the public, clients, etc., in any way, shape or form, this is going to impact you. So we know that back at the end of March that we had the Prime Minister advise us that all Australians should stay at home, except for a limited number of reasons, and that all Australians who are able to work from home should do that whenever and wherever they can, and that continues to be the baseline. Particularly for this stage one of the three-stage restriction sort of lifting protocols that the government are looking at. And as I said, in New South Wales, we'll have some of those elements of stage one coming into place this Friday. But certainly the intention is not that people will be back in office spaces and working from premises until stage 3, which is not anticipated to be before July, and it may well be later than that because the government's built in 3 weeks of review periods between those stages to just see what the impact of releasing restrictions in each of those stages actually is. And of course the timetables for that will be entirely decided by the relevant head of the relevant state and territory in each case. So as you've seen already, different states and territories are moving at different paces with different things depending on what their own individual circumstances are. So keep watching this space in terms of as these things develop. So from the end of March, we did have the Prime Minister saying basically if you can work from home and your employer can make that happen, then that's what you should do. And that's what we're being advised we should continue to do until such time as we get to stage 3, where there's an expectation, an anticipation perhaps at this stage, that most businesses will be back trading in their premises. If it's not possible to work from home or to redesign your work practices so that that's feasible, it remains vital that no staff member comes to work affected in any way, shape or form by illness, particularly cold and flu symptoms, fever, cough, sore throat, shortness of breath. Get tested immediately if you develop any or all of those symptoms, but certainly do not come into work. And as employers, it's incredibly important that we're sending that message very loud and clear. The Chief Medical Officer has been very deliberate in his messaging around that, particularly last Friday after the National Cabinet. He said this gone are the days of the stiff upper lip and people, and I'm guilty of it, I'm sure there's plenty of others who are, coming into work feeling less than 100%, because you feel you have to, and then busy sharing that love with everybody else. Those days have to be gone, particularly in COVID, but moving forward, because the nature of viruses and pandemics and such is that this won't likely be the first. Certainly hasn't been the first, certainly won't be the last. So we still need to keep physical distancing in place. So while we're going to see some relaxation come this Friday in New South Wales, and in other places it's already happened, where cafes and restaurants with seating capacity, for example, and retail stores and outlets are allowed to have 10 people in their space, we still need to be vigilant about social distancing. And some of the concerns that have been expressed since National Cabinet's decisions on Friday about this national 3-stage easing of restrictions framework is that a lot of people got out into shopping centres and retail venues and so forth, and there was observably very minimal social distancing happening. That's going to be a real problem from a health and economic perspective. Health from the perspective of, that spike in infections is likely to be higher. We know that our health facilities can cope with that now, which is one of the reasons for allowing some restrictions to ease, and we can also trace the sources better. However, if you in your work environment do not follow these public health regulations, and your staff or somebody in the public contracts COVID in your workplace, you are seriously liable. And so it's incredibly important that you continue to follow these provisions, particularly as you might start to bring the public or clients back into your premises relative to what you're allowed to do. If you don't have appropriate measures in place for hand washing and hygiene, where you have access to hand sanitizer, hand washing and hygiene facilities, you don't practice social distancing, you don't keep up with any or all of those things, and somebody is demonstrated to have contracted COVID in your workplace, then you're going to have some serious legal issues. So it's incredibly important to be mindful of that. You also need to be really mindful about signage and posters. You need to have signs and posters around the workplace to remind your staff, as well as any others that are interacting with your staff, members of the public, clients, etc., of the risks of COVID and the measures that are necessary to stop its spread. So it's incredibly important that you have access to those. If you don't have them, again, get up on the Safe Work Australia website and have a look at where you can get hold of those and what those look like. You need to make sure that your workplace is regularly cleaned and disinfected. And obviously, I'm going to anticipate that as employers, you've already got regular scheduled cleaning of your workplace in place. But any areas frequented by staff or visitors to your premises, whether they be public or others, are cleaned at least daily. So whatever your schedule is now, it needs to be daily. And after the business closes at night, you need to thoroughly clean with detergent or disinfectant, and that should happen before the business is ready for opening the following day. So your cleaning and hygiene practices need to be ramped up significantly for you to be able to relax restrictions in your environment relative to the decisions that have been made by your respective state or territory. You should also allow all workers, including vulnerable workers, to work from home wherever you can until we get to the point of stage 3, where it's anticipated that most people will be working in their usual place of work by then. Until that time, you should allow all workers, particularly including vulnerable workers, to work off-site and in an area that might be more safe for them. You've got obligations as an employer where, and so do all Australians, in terms of self-isolation. If you have a diagnosis with COVID-19, if you suspect that you may have it, if you've been in close contact with a confirmed case, So you must stay at home for 14 days. Now, most of the modern awards, all of the modern awards, I think, had unpaid pandemic leave inserted into them a number of weeks ago. And there's also questions about whether staff might be able to use paid personal carers leave. Talk to us if you've got any questions about that. And certainly if you've got any staff who are over 70, over 60 with particular existing health conditions or comorbidities, or you employ Indigenous Australians over the age of 50 who have existing health conditions or comorbidities, then there is certainly an expectation around, an even further greater expectation around self-isolation and working remotely as and where that's absolutely possible. If it's not possible to maintain a reasonable degree of safety for your staff in the work environment, then you should think about whether or not they should actually be working in that environment. Again, talk to us, get advice. So what can I do then is the big question to keep my workers safe at the workplace and limit the spread of COVID-19 as things are starting to reopen and so forth. You still need to keep monitoring who can do their jobs from home and give workers the option to do so where that's feasible. You need, where that is feasible, to make sure that you give guidance to your staff on setting up a safe home work environment, and I've talked about that in previous live streams. We have available on our website checklists for you, and there's also a very good working from home diagram and checklist on the Safe Work Australia website as well. You need to make sure that your staff do complete that self-assessment checklist and ensure they have good ergonomic practices in place, and you need to retain that. You should get them to take photographs of their environment that they're working in at home so that you can be sure that they're able to work safely and healthily. Have somebody in your work environment that who's a contact person, whether it's you if you're a small business. In the case of my business, it's me, who staff can talk to about any concerns that they might have about working from home. Set up ways to communicate with staff online, obviously through Skype or Zoom or Facebook live stream, and we certainly do that in our business, and communicate with them daily. Communication becomes really important in a situation where you can't just pop your head in the door and ask for things, get somebody's opinion, etc. And make sure that staff have access to any information that would support them during this time. You need to make sure that if you've got a physical work environment that is being reactivated or is currently activated, or you're thinking about doing that come Friday or Monday in New South Wales, for example, that you put up posters, I've mentioned this before, around the workplace on keeping at least 1.5 metres distance between everybody. That includes clients as well as staff. Make sure that you've got signs at the entrance to lifts and meeting rooms to ensure that safe capacity in those spaces is not exceeded. You will need to move workstations, desks, tables in staff rooms further apart to comply with social distancing. If you're a restaurant or a cafe or a retail space, you will need to make sure that you have designated spacing identified in your environment. If it's possible to bring in shift arrangements so that less staff are in the workplace at once, that is also really helpful. And I know a number of our businesses that are clients of ours have already done that very successfully and continue to do that. Let staff know that they should have meetings by phone or online instead of in person where they can. And where that's not possible, that they meet in a large space and keep meetings short. Where you've got a business that you're getting deliveries, you need to review what those look like and request contactless delivery, and check that systems are in place for e-invoicing wherever possible. Provide social distancing markers on the floor in areas where customers might line up or where workers might perform tasks. And nominate somebody on the work floor to be responsible for keeping everyone at the required 1.5 metre distance in accordance with the latest government requirements, and of course those are changing, which is why one of the reasons we're doing these every day. So it's important for you to understand what your obligations are at any particular point in time. And as I said, as a fundamental set of legislation and regulations, already as business owners and employers, we have substantial health and safety obligations. You may not already know about that, but you already have significant obligations, and they're being tested to the limit right now. And this is why you need to have all of these processes in place that specifically relate to COVID-19, sanitation, hygiene, etc., physical distancing, but you also have a significant number of other health and safety obligations which we can take you through ordinarily that you need to be mindful of. So in terms of hand washing and hygiene, if you're looking to reinvigorate work spaces, whether you're in retail, hospitality, or any kind of public facing service, you need to have hand sanitizer stations at entry and exit points around the workplace. You need to make sure that all your bathrooms are well stocked with hand wash and paper towel. You need to put up posters with instructions on how to hand wash and hand rub. You need to instruct your staff on other ways to limit the spread of germs, including by not touching their face, sneezing into their elbow, and staying home if they feel sick, which I talked about before. It would also be really helpful to have automatic alerts set up on your computer systems to remind staff about washing hands and not touching their eyes, face, nose, etc. Instruct your staff to limit contact with others, no shaking hands, no touching objects unless you absolutely must. If you can, only accept cashless transactions. Increase access to closed bins in your workplaces wherever possible, and put up signs to request your staff only touch objects that they're going to buy. That is incredibly important also. In terms of the cleaning side of things, ensure that any areas that your staff work in or that other people visit your premises are cleaned at least daily with detergent and disinfectant. You may not have had a daily cleaning schedule, but you need to now. You need to make sure that you instruct your staff to wear gloves when cleaning, if they're doing any cleaning, and wash their hands thoroughly with soap or an alcohol-based hand sanitizer before and after wearing those gloves. You need to clean frequently touched areas and surfaces several times a day with a detergent or disinfectant solution or wipe. And that includes FPOS equipment, elevator buttons, handrails, tables, countertops, doorknobs, sinks, and keyboards, and mice, all of those kind of accessories. Instruct your staff to clean personal property that comes to work, such as sunglasses, mobiles, iPads, with disinfectant or disinfectant wipes. You want to make sure that you put up signs about the symptoms of COVID in the workplace. Make sure that you direct staff to stay at home if they're sick in any way, shape or form, particularly if they're displaying symptoms that might be of COVID, and to get them to call the National Coronavirus Hotline, 1-800-020-080. This is all available on the Safe Work website, if they're concerned that they may have symptoms. Make sure to let staff know that they must tell you if they're displaying any symptoms of COVID-19, have been in contact with anyone who has it, or if they've been tested or intend to be tested for COVID-19. Make sure that you're reminding your staff about their leave entitlements if they're sick or they're required to self-isolate or self-quarantine. You need to ensure as an employer that you continue to treat the information that staff give you about themselves and their health very carefully and strictly confidentially in line with privacy laws. And if you're not sure about your obligations in that regard, please get in touch with us. If it's possible for any staff who are required to self-isolate or self-quarantine, but who are not displaying symptoms of COVID-19, if it's possible for you to facilitate them working from home, then you should do that as far as you possibly can. And finally, but perhaps we should have mentioned this right at the outset, plan ahead. For New South Wales, your options start to increase on Friday. But you should be thinking very carefully about what and how you might bring about easing of restrictions in your practical circumstances for your workplace. or workplaces. Talk to us if you've got any doubts. We can certainly help you get a plan in place and make sure you have all of the things you need to do sorted before you go exposing your staff and the public and so forth to your premises again. You want to nominate a staff member or a team of staff members to champion safe practices in the workplace and teach their colleagues the proper procedures that we've been talking about this morning. This is a fantastic opportunity to really get up to speed on your work health and safety practices, get all your staff on board, get champions in your work environment for safe work practices and practice them moving forward. So COVID is a terrible thing. I would not have wished it on anybody, but it's certainly given us as employers an opportunity to really get our act into gear. And certainly if we don't, there's going to be some fairly significant consequences. So we don't want that either. But we shouldn't just be acting out of fear or risk management. We should also be acting out of our own care and concern for our staff and our public and our clients, and doing all of the things that we can to make sure that our workplaces are safe for all of those people and all of our stakeholders. You need to have a plan in place for business continuity if you end up with a suspected or confirmed outbreak of COVID-19 in your workplace. I cannot stress this highly enough. We know that businesses have already been significantly impacted by the public health announcements. If you end up with COVID in your workplace, you're going to have a continuity plan. So talk to us about getting that in place. Consider what you will do, what your plan of action is going to be if one of your staff is suspected or confirmed to have COVID, including how you're going to support that person, and what you need to do to ensure that the workplace remains safe for everybody else. Make sure that you have appropriate cleaning products, personal protective equipment, etc. available to disinfect your workplace in the event of an outbreak. You need to have access to that pretty quickly. If you don't, consider options for hiring a cleaning company to do the work, but you need to have all of that information available on speed dial. Know that that company or support can come in and help you when you need it. And then you need to have a protocol in place for reopening your workplace after an outbreak or a quarantine period. So I know this is a lot to digest. I know that it's quite a frightening prospect, but these are things that we are all obligated to be mindful of and be aware of and comply with as employers. What I would advise you is if this has left your head spinning, or if you're not quite sure, or you are sure about, okay, I need to do X and then Y, I need to plan, I need to talk to my staff, I need to make sure I'm meeting my obligations, I need to know what they are so that I can make sure that I meet them. Talk to us. We can make sure to work with you and get these things in place with you very, very quickly so that you are doing all of the things that you need to do. Just call us, email, text, message. We are here to help you. Okay, so I haven't had any questions in the chat screen to this point in time, but I have got 3 that have come through that I'm going to let you know about and answer that have some relationship to what we've been talking about this morning in terms of health and safety and preparing to be back in a work environment of some description. And the first question that I've had is, if we're allowed to reopen with restrictions, this is a business that hasn't been in operation. So what if we're allowed to reopen with restrictions, but doing so still isn't commercially viable for my business? Now, this has come from a business that had to stand down staff because there was no work available. They couldn't stay open. And so they did close temporarily and put all of their staff on stand down in accordance with the Fair Work Act. So this was not a JobKeeper enabling direction. There are specific JobKeeper enabling directions to do with stand down that business owners who are eligible for JobKeeper and whose staff are eligible can utilise, and there's temporary changes that have been made to the Fair Work Act until the end of JobKeeper to enable that to happen. But this was a business this was well before JobKeeper or knowing as to whether or not they'd be eligible, so they had to give stand down provisions under the Fair Work Act, where they the only purpose for stand down in that circumstance is if there is a stoppage of work, and in that instance there was a stoppage of work. Arguably, with the public health restrictions being eased, there is no longer a stoppage of work completely, But they've got a situation where if they reopen their business with the 10 people restriction that and so forth, it's still not going to be viable for them to actually, commercially viable for them to operate. They've asked, can I keep staff on stand down, non-job keeper, as I've clarified, if there's no longer a stoppage of work? Oh, and the answer to that question is it depends, and possibly not. So we're actually going to be sitting down and talking about working through this with this particular business today so that we work out what they can and can't do. I'll give you more information as that unfolds, but that's one of the curly questions we've already had. The other question we've had is, I've got a staff member who is immunocompromised. What should I do? Be very, very careful is the answer to that question. That it could be that staff member says to you, look, I know restrictions are being eased. I know that you're putting in place all of these things, but I still feel incredibly nervous about being physically in the work environment with an increased risk. In that instance, it might be possible for you to still have this staff member working remotely. It might not be possible for that to happen. Talk to us. We can help you through that situation, depending on the measures you've put in place and how reasonable it would be to expect somebody to come back to a work environment who is immunocompromised. All those factors would have to be taken into consideration as to what you would do in that situation. And the final question that we've had is, I've got a staff member who's refusing to return to work because of her belief that she's at increased risk of getting COVID and passing it on to elderly family that she lives with. What should I do? Now, this is a business that is looking to partially reopen on Saturday. They're a retail business, and they've got a staff member who's really uncomfortable about coming back and working in the shop because they believe that even with all of the protective measures in place that the employer plans to put in place, all of the things that we've talked about today, that she believes she'll be at an increased risk of catching COVID and then passing it on to vulnerable relatives that she shares a home with. That's a really tricky question. The answer to that question is going to be whether or not the business owner, and again, we're working through that with them at the moment, is going to be taking all demonstrable measures that they can to minimise this staff member's exposure to getting COVID from the public or clients or what have you, or indeed getting it in the work environment. So whether her refusal to return to work is reasonable in those circumstances will depend on what the organisation has in place. And in that case, we're actually probably going to get some advice from iCare as well. So I'll give you further information about those three rather complex questions as we move forward, because this is, as we know, and has been for the previous 9 weeks, a movable feast. So what are some of the practical realities of making sure that you keep your work environment healthy and safe for your staff, your clients, the public, other stakeholders, etc.? First and foremost, get advice and plan. Have a really good plan in place. Have good, robust policies and procedures in place. Tick off all of the things that we've talked about this morning in terms of preparing your workplace, and that goes to planning, having all of the requisite components in place, signage, hand sanitizing equipment, hand hygiene, wiping down surfaces, 1.5 metre distancing, observing limits, informing your staff, keeping them regularly advised, etc. That communication piece is so incredibly important to continue doing, and obviously vigilance. One of the things that we saw happen, so a lot of us who were out and about on the weekend at different points saw that there was a lot of relaxation happening, but not in a good way necessarily, in terms of people observing social distancing and so forth. So we need to be incredibly careful, and the reality is that all of us as employers are liable under health and safety legislation if staff or members of the public contract or injure themselves when they're in our particular environment. So we need to be really mindful and careful. So I haven't had any other questions that I can see that have come through the chat screen at this stage. So I'll wrap up now, and thank you so much again for joining us today. It's delightful to have you with us every every weekday. As I said, these sessions are saved up into our Facebook page, YouTube channel, and also in LinkedIn, and you'll also find them on our webpage. If you have any particular questions about your business, or you want us to help you with anything to do with this, whether it's HR, health and safety, etc., get in touch with us by the contact information our staff have put up in the chat screen. And tomorrow I'll be continuing the discussion of work health and safety, and having a real close look at what does normal look like now. And there are some specific areas that we'll cover off in there as well. So please join us and invite your colleagues and friends. Send through any questions you've got in the meantime, because we're going to continue the discussion tomorrow. In the meantime, please hug the people that you can and wave cheerily at those that you can't at the moment. Stay safe, stay home where you can, wash your hands, and we'll really look forward to seeing you tomorrow. Thanks so much for joining us.